it carb confusion. People with diabetes often report that figuring out how many and which type of carbs to eat can leave them stumped. Family medicine physician Eilene Weibley explains how to choose your carbs wisely to control your blood sugar and your weight.
Taking all your medications?
Yes. I get a lot of patients who come in and they tell me I've been doing a great job, I've been eating really healthy, and then we start to look at their diet and we start to recognize really quickly, though we meant to make really great choices, some of our choices could have been better.
Dr. Weibley admits most patients know to avoid the white stuff, like white breads and pastas and rices, but where the carb confusion kicks in is knowing what to replace it with.
So the key word that I would tell patients to look for is whole grain pastas, whole grain breads. Some of those products have a much lower sugar content and are better suited to a diabetic patient.
Next up, skipping sweets. According to the American Diabetes Association, having a piece of fresh fruit is a great way to satisfy your sweet tooth. But Dr. Weibley warns not all fruits are created equal.
Bananas, pineapples, watermelon would all be fruits to avoid. And then fruits that would be healthier for patients and better options for especially diabetics would be the berries. So strawberries, raspberries, blackberries, apples, and pears would be a much better option.
And don't go nuts when it comes to, well, nuts.
There's some recent studies that have come out just with nuts. So specifically walnuts, almonds, pistachios have been shown to decrease cardiovascular risk factors. And these were studies that were done specifically in diabetic patients.
And diabetic or not, most of us can benefit from taking a closer look at our food choices.
I would say the majority of patients, they're starting in the right path, but the majority of my diabetic patients can always use a little bit of a tune-up, some more than others.
For Millennium Medicare Connect, I'm Robert Van Winkle.